HSM 801, page 463. 21 priority initiatives underpinning for HSSB blueprint. 70 plus initiatives developed and approximately 20 prioritized. So the priority areas are 21. We're going to list them. Pillars are 1. Effective governance. 2. Efficient, equitable and quality health system. 3. Unlocking value chains. 4. Health security. Then the enablers: data and digitization, financing, culture and talent within MDAs. So the 21 priority initiatives. 1. Strengthen NCH as a coordinating and accountability mechanism across the health system. 2. A sector-wide action plan swap to defragment health system programming and funding. 3. Simplify regulatory frameworks and accreditation processes for healthcare workers and facilities. 4. Increase collaboration with internal and external stakeholders for better delivery and performance management. 5. Comprehensive and intentional communication strategy for stakeholder engagement and advocacy. 6. MNCH task force and new accountability mechanism to crash MMR and under 5 mortality. 7. Accelerate immunization programs for priority antigens, e.g. DPT3, polio, measles, yellow fever, with a focus on decreasing zero-dose children. Number 8. Revitalize BHCPF to drive SWAP to increase access to quality health care for all citizens and to increase enrollment in health insurance. 9. An NCD prevention task force with a focus on high priority illnesses. 10. Communicable disease prevention task forces focused on HIV, TB and malaria. 11. A network of quaternary care facilities to enable resource pooling and improving access to highly specialized care. 12. Position Nigeria at the forefront of emerging R&D innovation, starting with local clinical trials and translational science. 13. Stimulate local production of health products, e.g. drug substance, fill and finish for vaccines, malaria bed nets, therapeutical foods. 14. Strengthen specified surveillance and routine surveillance to enable real-time early warning systems. 15. Access and improve pandemic preparedness, including simulations, preparedness, assessment, strategics, stockpiling. 16. Sector-wide data governance framework to ensure standardized data collection and usage. 17. An integrated single source of truth data system that is digitized, interoperable, and accurate. 18. Improve oversight and monitoring of budgeting process to increase budget utilization. 19. Regular effective skills and performance appraisal of top leadership. 20. Transformation within FMOH towards a values and performance-driven culture. 21. Top talent learning program to develop well-rounded for public health leaders. HSSB Pillars 4, Enablers 3, Priority Initiatives 21, SWAP Focused Initiatives are 13. So you need to look at this page 464, Strategic Blueprints, Priorities, Inspiring Health Sector Priorities. So go look at it, page 464. Page 465, the strategic vision for the health sector will be guided by progress in key outcomes. The key outcomes: you have saved lives, you have reduced physical pain, you have reduced financial pain, you have produced health for all Nigerians. So under that you have different other things: mortality, quality of life, quality of care, health financing, risk factors, access. So you can look at this in detail again. Page 465. Strategic framework. Strategic object pillar / enabler 1 and strategic objective, then PI number, then priority initiative. So pillar / enabler 1, effective governance. Strategic objective 1, Strengthen oversight and effective implementation of National Health Act. 2. Increase accountability to and participation of relevant stakeholders and Nigerian citizens. 3. Strengthen regulatory capacity to foster the highest standards of service provision. 4. Improve cross-functional coordination and effective partnerships to drive delivery. Priority initiative. We can look at it under priority initiative 4.5, a sector-wide action plan swap to defragment health system programming and funding. 5, increase collaboration with internal and external stakeholders for better delivery and performance management. Strategic framework 2, priority initiative, strengthen NCH as a coordinating and accountability mechanism across the health system. Strategic intervention, review NCH meeting and memo guidelines to ensure meetings focus on national health policy and national health development plan reviews and updates, including a conversation on the state of the health of the nation report to inform policy decisions. Build the capacity of NCH secretariat members both at federal and state level to ensure their effectiveness in supporting the technical committee. Next point, adequately resource the NCH secretariat to ensure the effective performance of its duties. Next one, create clear accountability mechanism to track implementation of NCH resolution. Strategic framework. 3, pillar/enabler. You have efficient, equitable, and quality health system. Strategic objective. 5, drive health promotion in a multi-sectoral way, inclusive intersectionality with education, environment, wash, and nutrition. Priority initiatives. 6, drive multi-sectoral coordination to put in place appropriate policies that drive health promotion behaviors. 7, accelerate intersectoral social welfare through coordination of efforts of the Social Action Fund. 6, strategic objective. 6, strengthen prevention through primary health care and community health care. Under priority initiative, you have accelerate immunization programs for priority antigens, e.g. DPT-3, polio, measles, yellow fever, with a focus on decreasing zero-dose children. 9, slow down the growth rate of NCD prevalence. 10, reduce the incidence of HIV, tuberculosis, and malaria. Strategic objective 7, improve quality of care and service delivery across public, secondary, tertiary, and quaternary and private healthcare providers. Under the priority initiative 11, revitalize tertiary and quaternary care hospitals to improve access to specialized care. 8, strategic objective, improve equity and affordability of quality care for patients, expand insurance. Under the priority initiative 2, improve reproductive, maternal, newborn, child health and nutrition. 13, revitalize BHCPF to drive SWAP, to increase access to quality health care for all citizens and to increase enrollment in health insurance. 14, expand financial protection to all citizens through health insurance expansion and their innovative financing mechanisms. 9, strategic objective, revitalize the end-to-end production to retention healthcare workers pipeline. Priority initiatives. 15, increase availability. And increase availability and quality of HRH, human resources for health. Strategic framework 4, pillar/enabler, unlocking value chains. Strategic objectives 10, promote clinical research and development. 11, stimulate local production of health products. 12, shape markets to ensure sustainable local demand. Number 13, strengthen supply chains. So priority initiatives. Position Nigeria at the forefront of emerging R&D innovation. Starting with local data trials and translational science. Number 11, stimulate local production of health products. That's for strategic objective number 11. Number a priority initiative 17, stimulate local production of health products, e.g. drug substance, fill and finish for vaccines, malaria bed nets, and therapeutic foods. Number 12, strategic objective, shape markets to ensure sustainable local demand. Priority initiative, build, sustain off-take agreements with development partners for locally produced products required in Nigeria. 13. Okay, number 13 objective, strengthen supply chains. Priority initiative 19, streamline existing supply chains to remove complexity. Strategic objective number 14, improve the ability to detect, prevent, and respond to public health threats, e.g. cholera, Lassa. Priority initiative number 20, improve pandemic prevention, detection, preparedness, and response. Number pillar/enabler. Next one is health security. Under that, you have strategic objective. That is improve number 14. Improve the ability to detect, prevent, and respond to public health threats, e.g. cholera, Lassa. Priority initiative, improve pandemic prevention, detection, preparedness, and response. Strategic objective number 15, build climate resiliency for the health system in collaboration with all other sectors. Priority initiative 21, establish a One Health approach for threat detection and response, incorporating climate-linked threats. Strategic framework 545, pillar enabler. Next one we're looking at is data and digitization. Strategic objective number 16, digitize the health system and have data-backed decision making. Priority initiative number 22, strengthen the health data collection, reporting, and usage, starting with the core indicators. 23, priority initiative, establish and integrate a single source of truth data system that is digitized, interoperable, and accurate. Pillar/enabler, financing. Strategic objective number 17, increase effectiveness of healthcare spending. Number 25 for priority initiatives. 24 rather. Improve oversight and monitoring of budgeting process to increase budget utilization. 25, regular and effective skill and performance appraisal of top leadership. Pillar/enabler. Next one is culture and talent. Strategic objective number 18, strengthen skills, capabilities, and values, and drive a performance-based culture within the FMOH. Transformation within FMOH towards a value and performance-driven culture. That's for priority initiative number 26. Number 27, top talent learning program to develop well-rounded for public health leaders. Health sector-wide approach, SWAP. What is a sector-wide approach? SWAP. It's page 471. Based on the guidance and direction provided by the Sector-Wide Approach Coordination and Delivery Office and Federal Ministry of Health. SWAP, sector-wide approach, aims to build a more unified, effective, and sustainable health sector. All stakeholders consider the whole sector and endorse strategies, measure progress, and agree on revisions. Funding sources and flows are visible and allocated against agreed programs to reduce gaps, overlaps, and inefficiencies, e.g. consolidated funding streams, increased reliance on government fiduciary system. Government rather than DPs set, that's the parameters and parastatals, set priorities for support and leverage its systems to reduce redundancy and ensure TA is demand driven. So this is actually a big there's a lot of information, so you can look at it. Okay, that's page 471. That's where it is. Page 471, plan. 13 health sector priorities reflect some of the most urgent needs for the health system. Okay, so again, this page 472, you can look it up in the slide. Okay, so the National Health Sector Renewal Initiative will be driven through SWAP. SWAP as an approach to strengthen Nigeria's health system to achieve 1. Increased coordination. 2. Stronger national leadership and ownership. 3. Strengthen management and delivery systems for improved health outcomes. 4. Efficiency and equity in the allocation of resources. 5. Reduce transaction costs. 6. Sustainability of health policy and systems development. 7. Improved aid effectiveness and health sector efficiency. Conclusion. Our world is rapidly changing and local health systems need to change. There is an increasing frequency, magnitude, and impact of shocks on the national system. Need for sustained efforts at health system strengthening. Urgent need to consider system reliance as a critical goal in health system strengthening. Timing is essential in undertaking health system strengthening. So thank you, Resource Bank. So this is the end of this topic. Topic ended at page 475. Page 475. So the next set of recordings will start. The slides will start at page 476.